Hello, and welcome to Chapter 1 of our FSPCA curriculum over preventive controls for animal food. In this chapter, we're going to look at some of the regulatory overview and just get an introduction to the rule itself. Here are the learning objectives we'll be covering. First and foremost, we're going to look at the requirements of 21 CFR Part 507, Current Good Manufacturing Practice, Hazard Analysis, and Risk-Based Preventive Controls for Food for Animals. So that whole statement there is the actual whole title of the FDA regulation that we're covering in this course. Sometimes I'll refer to this as just Part 507, or just the animal food rule, or preventive controls for animal food. But that's the whole title there. And it kind of gives you a little bit of preview of the different parts of the regulation that we're going to be learning about. We have broken up this regulation into 6 subparts. In this chapter, we're going to cover 3 of those subparts. So you can probably already tell that the other 3 are going to be kind of the meat and potatoes of this regulation. Subpart A, we're going to look at general provisions, kind of who's in, who's out, who gets exemptions, and some of the background of the rule itself. Subpart D, we are going to talk about qualified facilities a little bit and how their exemption can be withdrawn. And then Subpart F, we'll talk about some of the records that will be required for compliance with this rule. Subparts B, C, and E are our other 3 subparts that cover most of how we develop a food safety plan and do that hazard analysis process. And those are going to be covered in chapters 2 through 10. So to get us started here, here's a list of some of the most significant laws regarding animal food safety that have been developed over the years. The first one came about in 1906. That was the Pure Food and Drug Act. Now this was mostly like a labeling regulation to ensure that products, including food and medicine, had any potentially dangerous ingredients identified on the label. This regulation actually took 27 years to write before it was finalized in 1906, and really it paved the way for the establishment of AFIA, the American Feed Industry Association, in 1909, and also the American Association of Feed Control Officials, and then eventually the establishment of the FDA in 1930. So kind of a big step there for our animal feed regulation. This Pure Food and Drug Act was modified a little bit and reworked to, I guess updated is a good word to use for it, in 1938. With the Federal Food, Drug, and Cosmetic Act. So this was a really comprehensive act, and it essentially just replaced and updated the Food and Drug Act. As we kind of had more increasingly complex foods and medicines available on the market, just kind of the need for advancement drove the need for some new regulation there. In 1958, we had the Food Additives Amendment, and this came about because we started putting more supplements into our animal feeds. Pesticides were being used more in farming, so we just needed to regulate those types of substances and make sure that they're safe for our animals. In 1976, the Medicated Feed CGMPs were established, and this kind of came about because we had more medicines and antibiotics becoming available on the market, and we just needed to ensure that people were using them correctly. 1996, we saw the Animal Drug Availability Act. Sometimes this is referred to as the Veterinary Feed Directives, and this kind of just improved the process for testing and approving medicated feeds. 1997, we saw a reaction to the outbreak of BSE, so we have some BSE and ruminant feed regulations that came about as a response to mad cow disease. 2002, in response to 9/11, we have the creation of the Bioterrorism Preparedness and Response Act. This is sometimes referred to as a food facility registration or Part 415 registration. This is a really critical step right here because what we're going to see as we get into the wording of FSMA, of the Food Safety Modernization Act, and specifically Part 507 of that rule, If a facility has to register as a food facility, as in they have to comply with the Bioterrorism Preparedness and Response Act and register under 415, they will also have to comply with Part 507 that we're covering in this course. Okay, so if you're currently working for a facility and don't know whether you guys have to register as a food facility, please pause this recording and go and find that information so that going forward you can know where you fall within the lines of the regulation. Okay. 2007, we saw the Food and Drug Administration Amendments Act. This was mostly a Medication and Human Health Act, but it did increase the involvement of FDA in animal food recalls and also like adulteration assessments. In 2011 is when we saw the finalized version of the Food Safety Modernization Act, or FSMA, as I like to call it. And this kind of came out of a reaction of 3 major foodborne illness cases. The first one was the melamine incident that happened in about 2007, 2008 with some intentionally adulterated dog food that caused a lot of deaths, a lot of sicknesses, and also a lot of loss of revenue. The Peanut Corporation of America incident that happened in 2008 and 2009, where we had salmonella in peanut butter, was another one that caused a lot of damage. And then in 2011, we had a large outbreak of listeria in cantaloupe, which also just kind of highlighted the need for some reform in how we are regulating our food and how we're making sure that that food is safe when it gets into market. So this rule is what we are focusing on in this class, specifically Part 507 of the Food Safety Modernization Act that just solely focuses on animal feed production. FSMA encompasses a lot more than that, but for the purposes of this class, we're just focusing on that one part. After FSMA, we did see the introduction of some new veterinary feed directives. They were revised at least. And this was mostly in response to the increasing antimicrobial resistance phenomenon that we're seeing. So just some more measures to help prevent that. So like I've been saying, we're going to focus on the Food Safety Modernization Act in this class, or FSMA. And so just a little bit of background on that. It was signed into law on January 4th, 2011. As I said, it kind of came as a response of many foodborne illness cases. And we have a couple of statistics here. So 1 in 6 Americans, or 48 million Americans, were sickened, 128,000 hospitalized, 3,000 die each year from foodborne illnesses. And that came from a CDC study in 2011. So those numbers are essentially just too high for what we expect a modernized country to be able to do at this point. So we needed to kind of make some reforms and respond to that to make those numbers smaller. This regulation, FSMA, is considered the most sweeping reform of food safety laws in more than 70 years. It's really kind of the only big change, comprehensive change that has happened since 1938, since the Food, Drug, and Cosmetic Act. We made amendments in between here and there, but this is really an all-encompassing change and really, again, an update to the regulation. And the goal of this regulation is to make a shift in the mindset of our food production industry. We have been set on responding to incidences of foodborne illnesses and incidences of adulteration happening. We've gotten pretty good at doing that. But what we want to shift to is a culture of prevention, where we're doing everything in our power and thinking through all of the possibilities to prevent an adulteration from happening. So just kind of shifting our frame of focus from response to prevention is the ultimate goal of the Food Safety Modernization Act. So these are the 4 pillars of FSMA that we consider when we're thinking about the creation of this rule. The first one is the prevention, and that's kind of the pillar that we are going to live in with through the duration of this class, thinking about how we design food safety systems to prevent adulteration. But of course, with that, we have some inspections, compliance, and response when it comes to the regulation and implementing those prevention strategies. Import safety is also a big part of FSMA, making sure that anything that we bring into this country is safe. And then enhanced partnership, so bringing that communication level up when it comes between industry and state regulation and federal regulation, and just making that whole communication line more streamlined so that with that goal of preventing adulteration. Here's a list of the 7 different rules that were created under FSMA. We are just going to focus on the preventive controls for animal food rule. Okay, but there's also preventive controls for human food. There's a rule about produce safety. There's a rule about foreign supplier verification programs, sanitary transport, accredited third-party certification, and mitigation strategies to protect food against intentional adulteration. This table right here kind of breaks those 7 down into what we need to be concerned about if we're in the animal food world versus the human food world. So on the left-hand side, we have everything that applies to animal food, and on the right-hand side, we have everything that does not apply to animal food, although as we're going to see, there is some crossover here and there between some of these rules. So this slide gives us a little bit of timeline of the creation of the Food Safety Modernization Act, and then also some of the compliance dates for different sizes of businesses. So in January 2011, FSMA was signed into law. October 2013, we saw the first version of the law. We call this the proposed rule. In 2014, we saw the revised rule. In 2015, in September, we saw the final rule published. And throughout this whole revision process, the writers were taking comments from the public to clarify different parts of the regulation, and those most important ones and most common ones can be found in the preamble for the rule. So if you ever have questions or need clarification or just want some context on different parts of the rule, the preamble may be a good step, a good first step to go to see if you can get that question answered. Below that, we have a table here of different business sizes and their compliance dates for 2 of the important subparts of this rule. Now, subpart B, we're going to cover in Chapter 2, and that goes over current good manufacturing practices. So there's some certain things that we're going to have to do in our daily operation to meet the requirements of this rule. And depending on your business size, you may already be in compliance or need to be in compliance with this. But you can see the very small businesses have until September 17th of 2018 to become in compliance with that part. Now, subpart C takes a little bit more paperwork and a little bit more diligence. That is the hazard analysis and risk-based preventive controls. So all of those compliance dates are 1 year out from the subpart B. At the bottom, we have the very small businesses category there. Those are the businesses that make less than $2.5 million in sales per year. So these are kind of the little businesses. We wanted to give them a little bit more time to get all their ducks in a row to make sure they're in compliance. A small business is considered any business with less than 500 full-time employees, and the regulation does give a definition of a full-time employee if you're interested in knowing what that is. And then everyone else falls into that other category. So all the big facilities fall into the all other categories and should be in compliance with both of these subparts at this point. If you are currently working for a facility, this is another piece of information I recommend you look up ASAP to figure out which of these categories you fall into and when you need to be in compliance with each of these subparts. So here's a little bit about the subparts of the regulation. I kind of mentioned these a little bit earlier, but these are the official names, and we can tell they're the official names because we have some italicized text in a blue box. Remember, that means we're looking at the actual text of the rule here. So subpart A is general provision, subpart B, current good manufacturing practices, subpart C is hazard analysis and risk-based preventive controls, subpart D is about withdrawing the exemption for a qualified facility. Subpart E will be about supply chain programs, and that kind of falls under subpart C, but it was kind of just too big to fit in that subpart, so it has its own subpart. And then subpart F is all about the records needed to be in compliance. I've already mentioned the preamble, but just as a reminder, the preamble does give a lot of context, and public comments can be found there about any of these parts of the regulation. This course does not go into specifics about which types of facilities have to comply with this and which don't. We'll go over that in general in just a few minutes, but if you ever have questions about that, you should, I'm going to direct you to the FDA's Technical Assistance Network, and the website is listed there, fda.gov/FSMA, and that Technical Assistance Network allows you to submit your questions and get them answered by an FDA representative. So that's a really good resource if you have any questions on this stuff. Okay, so we're going to start by covering subpart A, which is all about general provisions. So here's listed out are the names of the different parts within subpart A. It's 507.1 through 507.12. So we're going to start at 507.1, which is all about applicability and status. So who has to comply with this rule, and what's the point of this rule? So this slide, this piece of text here gives us kind of the point of this regulation. This part applies to determining whether the animal food is adulterated or in violation of Section 361 of the Public Health Service Act. Okay, so the whole point of this regulation is to prevent adulteration of animal food. This next section tells us that if you are required to be in compliance with 415, you also have to be in compliance with Part 507. And not doing so is illegal, essentially. It's a prohibited act under Section 301 of the Federal Food, Drug, and Cosmetic Act. Also, if you're currently subject to other good manufacturing practices, like, for example, the medicated feed CGMPs, you are still subject to those requirements, even if you are also subject to Part 507. So to summarize that, facilities that manufacture, process, pack, or hold animal food for consumption in the U.S. is essentially who has to do this. If you're making animal food, you have to comply with Part 507. You probably already have to comply with 415, but that's one of those lines that we can draw to say if you're in with 415, you're also in with Part 507. Not complying is considered a prohibited act. Animal food covered by other GMP regulations still have to comply to those regulations, such as medicated feed or low-acid canned feed. Part 507 covers a bunch of different definitions that are used throughout the regulation. I'd recommend pausing right now, going to Appendix number 1, and taking a look at all of the definitions listed there. We're not going to go through those at this point, but as we go through the chapters, we'll bring up definitions that apply to those specific sections. 507.4 talks about qualifications of individuals who manufacture, process, pack, or hold animal food. So who is involved in this process and what are their responsibilities? And what this first part, what Section A of this part tells us, is that when we're talking about Subpart B, the management of an establishment is responsible for making sure that everyone is qualified to do that job. But when we're talking about Subpart C, the owner, operator, or agent in charge of a facility is responsible for making sure everyone can do their job. Okay, so the difference between subpart B and subpart C is that we have a little bit more risk involved. We're kind of taking those prevention strategies and bringing them up a level. So along with that comes a increase in the responsibility level. So we go from a management position to the owner, operator, agent in charge. Now the rule doesn't define either of those things, but I'd recommend that if you're working in a facility, take a minute to consider who these are within your facility. Who might a manager be? Maybe a quality manager or a shift manager. Who's the owner, operator, agent in charge? Is that your CEO? Or is that going to be somebody else? So beyond the management and the owner, operator, agent in charge, we have a lot of other people involved in the manufacturing, processing, packing, and holding of animal food. And all of those people need to be qualified to do their jobs as well. These people all need to be what we consider a qualified individual under this rule. And we'll see a definition for a qualified individual in just a second. But essentially what this says is that anyone manufacturing, processing, packing, or holding animal food has to be trained and qualified to do their job. And they have to be trained in animal food hygiene and animal food safety. So from my experience, a lot of facilities are already doing both of those things, kind of mostly in a combination with each other. So as someone is getting trained for their new position, they'll also receive some sort of training about making sure that they're washing their hands at appropriate times, that their clothing is appropriate, that they're protecting the food that they're making. And that all kind of plays into the second piece of this, of animal food hygiene and animal food safety. But now, this is mandated as part of this regulation. Each individual manufacturing, process, packing, or holding animal food has to be qualified to do their job, and they have to receive that animal food hygiene training. And what we're going to see a little bit later is that you have to keep records of that animal food hygiene training on hand for a couple of years. That's going to be one of the few records that we absolutely have to do. But every facility will need to do it if they're in compliance or if they're required to be in compliance with Part 507. So responsibility for ensuring compliance by individuals with this part needs to be left to someone who's qualified to do that has the education or training, and just making sure that we have all of those roles assigned clearly will be important as well. Making sure you know who the management is, making sure you know who the owner-operator in charge is, and that they are making sure that all the personnel is trained. And then records that document the training required by paragraph B2, which is this one over here about hygiene training, of this section must be established and maintained and are subject to the record-keeping requirements in subpart F. And that's what we'll go over at the end of this chapter. Okay? So that's 507.4. We're jumping back just a second to 507.3 to the definition section to look at what a qualified individual is. So this is a person who has the education, training, or experience, or combination thereof, necessary to manufacture, process, pack, or hold safe animal food as appropriate to the individual's assigned duties. A qualified individual may be, but is not required to be, an employee of the establishment. Okay, so these people don't have to be trained in every single thing that happens in the facility. They just need to be trained as appropriate to their duties. This also applies to temporary and seasonal workers. So this is anyone in the facility helping with the manufacturing process or packing or holding of animal food. Even if they're only there for one day, they have to have training to do the job and training in animal food safety, and it's got to be documented. So here's all of that information, a little bit more friendly version of the text. So all individuals who manufacture, process, pack, or hold animal food must be qualified to perform their assigned duties. This includes temporary and seasonal workers, and they have to be a qualified individual as defined by the definition we just read. That means knowing how to do the job and having animal food hygiene training. The responsibility for making sure that your workers are qualified individuals changes depending on which subpart we're talking about. Subpart B, the management is in charge, and subpart C, the owner, operator, or agent in charge of the facility must oversee that part. Now, these trainings can be in any format. I've worked with a couple of facilities where it's a smaller facility and it's just one quality assurance person that works with new hires to take them through a hygiene training in person, verbally, and then they just keep records of that employee signing off that they went through the training. More facilities are going to a digital or online platform to help keep track of all of this. So we'll have employees go through a series of online trainings, and each one they mark off that they completed it, or take a small quiz after each one to show they understand the information. That's a pretty common platform. The American Feed Industry Association has produced a video that covers many of the food hygiene principles, and that is available for purchase through their website, and that's a pretty comprehensive video that can be used as a resource if you don't already have something established or are looking for a new version of this. The rule doesn't say what frequency this needs to happen at. Obviously, if it's a new hire, that person should go through these trainings to meet the definition of that qualified individual. But after that, there's no mandated like annual training or quarterly training. That's a business decision based on how much risk your business wants to take. I think common practice is an annual training, but again, it's not mandated by the regulation. And these trainings can come from any source. So it does not have to be a person in your facility doing this training. It can come from a third party as long as it's adequate and appropriate for the job at hand. Okay, so where we take this up a notch is now under this rule, if you are subject to subpart C, you have to have a preventive controls qualified individual involved in your food safety system. And here's the definition of a preventive controls qualified individual. This is a qualified individual, so someone who already has training for their job and has already received food hygiene training, who has successfully completed training in the development and application of risk-based preventive controls at least equivalent to that received under a standardized curriculum recognized as adequate by FDA, or is otherwise qualified through job experience to develop and apply a food safety system. Now, in the introduction to this class, I promised you guys that you would become preventive controls qualified individual, a preventive controls qualified individual. And we can see through this definition why that is. This curriculum we're going through is the standardized curriculum recognized as adequate by the FDA to show that you understand food safety systems and can develop and apply risk-based preventive controls. Now, there is a little bit of flexibility built into this definition here that says you can be a preventive controls qualified individual through job experience or some other training. So this course is not the only way to become a PCQI. But what's kind of common practice, or what is thought at this point, is that you may have the job experience to develop a comprehensive food safety system, but do you know all the ins and outs of the regulation? And going through a class like this, going through this type of curriculum really, fills in that puzzle piece there for you of making sure you understand all of the parts of the regulation and not just understanding food safety systems and how they work. Okay, so we need both of those pieces to be a PCQI. Here's some of the duties of a PCQI under this regulation. A lot of these we're going to get to in later chapters, so I'm not going to spend too much time on them just yet, but we can see number 1, they are responsible for the preparation of the food safety plan, which is essentially a food safety system just written down on a piece of paper. They're also going to have to do some validation and verification types of duties, but mostly their job is making sure the food safety system is designed correctly, it's implemented correctly, and that it's being followed as it was designed. So this is exercise 1 as we would do it in an in-person classroom. These questions and these ideas are going to be built into the first assignment that goes along with this module in this class. So at this point, I'd recommend taking a look at these questions, thinking through them, especially if you are currently in a facility, and then we'll come back to them when we get to the first assignment.